are elements of what people should be looking for when they look for a job. What's the nurse staffing ratio like? All those typical things. But what's the culture like? Are people supportive?
Yeah.
Because you kind of know nothing coming in at the gate, and you don't want to feel stupid or bothering people asking questions.
Yeah.
So many times I've had so many nurses just say, "Well, I don't want to ask too many questions." And I go, "Well, if you don't ask the question, that's how you're going to kill someone."
No, for sure. Listen, I totally get that, but for me, I will ask 5 bajillion questions, but I think it's because of the people I work with and the way they've kind of fostered that opportunity for me to not fear like asking questions. Yeah.
We've already started, so you guys can start.
Oh, we started? Okay.
Hi everyone, my name's Cassandra. I'm a clinical nurse educator and one of the co-founders of vitalpath.ca. I've been a clinical nurse educator and nurse for nearly 20 years, and my experience expands from critical care, emergency organ donation, and now professional practice. Today is our inaugural episode of our podcast, and today we have Evie as our guest. She's a first-year novice nurse in cardiovascular surgery. Today we're going to explore her journey from clinical extern, fourth-year nursing student to novice nurse in the NGG program and beyond. And hopefully today this will help answer questions on your journey that you're experiencing.
We can start with your first question.
So let's start with the first question. Okay. So why did you decide to become a nurse?
Oh, okay. So I was torn between being a teacher and a nurse actually, but I had no idea what it entailed to be a nurse. I really did not know what that meant. I just knew it's sciencey, and if you don't want to be a doctor, there's nursing. But then obviously there's not the stereotype, but like just people saying, oh, but like you're wiping bums all day, you know? That kind of deter people from wanting to go into nursing. So I'm like, okay, well then what is it, you know? And then it wasn't until actually I went to prom, and a girl who was older than me, she had just gone accepted to a nursing program, and I was telling her like, oh, I don't know if I want to go into teaching or if I want to go into nursing. And she's like, oh my God, I'm going into nursing, you should definitely do it. And I'm like, but I don't know what it is. Like, what do you learn? Like, do you learn like science courses, like chemistry, or is it like there's specific nursing courses? Like, I don't know what that means, you know? I had no knowledge on it. And she just kind of gave me a breakdown, and she told me like what courses she'd be taking first semester. And it was really appealing to me because I didn't really like the standardized components to school, like having to learn like the micro aspects of like biology, like that didn't really interest me. I kind of liked hands-on things. I liked looking at the bigger picture of things that I could actually apply to my work, like working in the field in practice. And I just found that like with the courses that nursing had to offer, it would give me more, I would be more aligned with what I was looking for in terms of like how I'm able to study, what I'm interested in when I'm studying something, and being able to apply that in practice. And that's when I was like, okay, like if I have to choose between doing like a biology major at U of T versus nursing, where like I have all these courses that like would be best suitable to my learning needs and my learning style, I'd rather do nursing. And then I just got lucky and I ended up really enjoying it once I entered the program.
Now, does anyone you know or anyone in your family actually work in healthcare?
So my mom back home is a physician, and then in Canada she works as a pharmacy technician. So I guess maybe, I don't know if there's like some sort of genetic explanation to that, because I feel like it's like commonly seen, but maybe she kind of, I don't know, like pushed that onto me subconsciously. I also did grow up watching Grey's Anatomy, so I don't know if that...
I don't know if that counts, because McSteamy, we all know why he died. That breathing tube was just way too far out. But yeah, no, it's that's really interesting, because you know my dad worked in healthcare as well, and so he worked in sort of as a CT tech, and then I became a nurse, my sister became a nurse. So it's kind of like a family thing. So it's always interesting to hear when someone who's considering a career in healthcare, I go, do you know? When you say you don't know what it entails, and then you come and then you go, oh my gosh, this is so different than I thought it was going to be.
Yeah, I don't know. Yeah, like my mom's like the only one who is in healthcare. But like growing up, I didn't like the maths. I was horrible at math. I wasn't a bad student, but I wasn't top of the class. Like I really, really had to work hard to get a good mark. I wasn't like academically advanced by any means. I'm someone who I love to learn. I'm very curious, but it takes me a lot of time, and I need to learn with like visuals and like hands-on. Like I hated standardized testing. I still hate standardized testing to this day. I don't think it's the most appropriate way to like prove that you're good at something or you can excel or be proficient in something. So like I was like, I feel like nursing is like the best resort for me because there is that hands-on aspect. There is a lot of opportunity to learn and grow within the profession versus like if I just like went in and did a biology major, I knew I would have been in a lecture class with 5 bajillion people and like I'd be learning things that would be very, very difficult to apply because you're not really applying like what you're learning in organic chemistry 1 in real life, you know? But like with nursing, you start off like one of your first classes is nursing fundamentals like 101 or something, and you're learning how to make a bed. You know, it sounds stupid at first, but like you're able to actually apply that because you're learning the content in class. You have like a 1-hour tutorial and then you have a lab that you're able to apply what you're learning, right? Which to me that really was aligned with my learning style and really fueled my learning style. So it made it a lot easier for me to do well or understand things and grasp things a lot more. So yeah, I knew if I went somewhere else and I just stuck with like a Bachelor of Science in something else, I wouldn't know what I was doing. I would be lost and I probably wouldn't have been like passionate about what I was doing.
So tell me about your first clinical experience, your first clinical rotation. Do you remember it?
In first year, you only have 5, at least at the school that I went to, you had 5 days within the whole year or something. But ours was online, so it wasn't actually like a clinical. I would say my legit first clinical was in second year, and that was at a rehab facility. And it was nice. I wouldn't say it was really overwhelming, to be honest, because I guess the expectations aren't as high and you're with like a group of people who are in the same boat as you. But I definitely think your clinical instructor or your preceptor make or break the experience. And my clinical instructor at the time, she was really engaging and wanted everyone to learn. But she was kind of like that like tough, I don't know, like just expected a lot from students type of preceptor. And it kind of was a little like overwhelming to be in that type of environment when you're expected of so much but you don't know what's going on. Nonetheless, I came out of that placement and I learned a lot, and I think it was a great basis to start me off with like just like nursing fundamentals, because then I went into an acute placement and I kind of had that basic knowledge like on helping patients with ADLs and like just the basics.
Hey everyone, we'll get back to Cass and EB in just 1 minute. My name's Alec. I am one of the co-founders at vitalpath.ca along with Cass. I just wanted to take a minute and talk to you about what you can get if you check out vitalpath.ca. What we've created is a free career kit for nurses in Ontario looking to get licensed and looking to find their first job, along with tools that can be used by nurses at any point in your career. Maybe you're looking to level up to your next position. Maybe you're looking for a change of scenery. We have tools to help you practice for your interview, tools to help you with your resume, and tools to help you find that next job that you're looking for. Take a look at vitalpath.ca, and now back to Cass and Evie.
Yeah.
So a lot of times I've heard from novice nurses that school doesn't necessarily really prepare them for being a real nurse. What is something that you've brought forward from your nursing school experience and clinicals that you've been able to apply in your everyday nursing career life?
That I've been able to apply or haven't been able?
You have been able to apply.
From nursing school? That's a really good question. I would say maybe charting. Like, I feel like charting was was very emphasized in nursing school, and talking about like your license and protecting your license. So like I find, not just with me, but many of my other new grad coworkers, like oftentimes the discussion is like, oh my God, charting is holding me back so much. And that's because we're so afraid because of the way we've been conditioned to like protect our license throughout nursing school. And honestly, there were a lot of like teachings around charting and documentation. Like we literally had a course on it, I believe, at my school. So definitely knowing when to chart and knowing that charting is really important. So I think with a lot of new grads, they really prioritize charting. And then as you like spend more time as a nurse, like you kind of learn like where it's necessary to chart, how much to chart, because also overcharting can get you in trouble too. But I would say the biggest thing I've been able to apply from nursing school is my charting. But if I'm being really honest, I think I want to say like 80% of what I've learned has been on the job. Like I would say nursing school has helped me just simply based off of the fundamentals of nursing, but everything I've learned has been on the job, which sounds kind of bad to say, and maybe a lot of people can relate to it. But my personal experience, that's kind of how it's been.
So why don't you share how you actually came to working in the unit that you're working in? So where did you consolidate? What kind of area did you consolidate in? And what helped you to decide to pick where you're working now?
Okay, so I did my consolidation. So I started off in the ICU. You were working there. Mm-hmm. I ended up going to medicine in that same facility. But it was like a medicine, like geriatric stroke tele unit. Mm-hmm. But while I was in nursing school, I picked up an externship position in second year in a CV surgery unit. And I work in that same CV surgery unit now, and the reason why I ended up going with there versus like an ICU or like any of the other places that I was more familiar with, because I was there almost like full time, right? Mm-hmm. The reason why I ended up going with CV surgery is literally and simply because of the work culture and the work environment there. Granted, I was working there for like 2 years at that point, and I had like grown to become comfortable in that environment with my coworkers. I don't think I would have moved in if there wasn't immense support from everyone, from the manager down to like other coworkers. It's a really great environment, and it fosters a really positive learning environment for new grads especially. And so I knew I couldn't give up the opportunity. I really liked like cardiology, cardiac stuff in general. So I said, I'd rather do this because it satisfies my interests, and also I have a supportive team around me, and I think that really makes or breaks your experience, not just as a new grad, but just in general. Like I literally never dread a shift.
That's good.
Yeah, so that's why I'm like, I didn't even like, there was no doubt. Like I knew from the second that I started my externship there that I was gonna work there as a new grad for sure. And it's been an amazing experience. So
tell me more about the support that was really important, because I think when we think support, it's like, oh, is someone going to help you come turn a patient or do this?
Yeah.
But like, what kind of support made it like key for you being like, this is my home. This is where I want to start my career.
Yeah. So first, maybe I'll talk more about being an extern, mm-hmm. and then I can go into like new grad because there's NGG that's involved there. Mm-hmm. But as an extern, I ended up going there. They give you a shadow shift, and they've even expanded like orientation for externs now in that unit, but at the hospital that I work at. When I was an extern, you would do like a shadow shift with a nurse for the day. And although it's very daunting being the new person anywhere, mm-hmm. but especially when you're new, especially when you're a student and you don't know what's going on, you mm-hmm. don't know how to be a nurse yet, right? But even though I was like, everything felt so daunting, like everyone was so open-minded, everyone was so welcoming and warm. And I know that can just be specific to like individuals, but I literally feel like the entire unit, because everyone's just struggling so much, it kind of brings like a sense of unity, you know, like everyone just becomes warm and welcoming with each other because everyone's struggling, because the unit's tough, you know, if a unit's tough, everyone just kind of connects better. And I just felt like coming there as a new like student or a new person, for some reason I was still welcomed with open arms. A lot of the nurses there were really engaging and still are really engaging, and they would always want to include me in opportunities to learn. I think it's also just very unit specific too. I think if it's more of a specialty, you'll find that nurses are in that specialty for a reason. A, they either have a passion for what they're learning, or B, they're curious people and they just constantly want to learn and advance in their careers. And people who are like that also have a desire to teach and a desire to encourage people and kind of incorporate them in the learning process. And with me, I think that's why I was like welcomed with such open arms, because everyone that I work with or that works in that unit, they just constantly want to learn. They're there to learn. They're not just there to work and just bypass the time. They really want to learn. And I guess also in a way teaching kind of makes them learn too. And yeah, I also work at a teaching hospital, so that also plays a huge part into it. But everyone just kind of welcomed me with open arms and just constantly was just encouraging me to come do ECGs with them or like assist them in inserting catheters, which is a huge skill that like no one prepares you for. I still like get scared to like insert a catheter now because of the sterility. But yeah, they were really encouraging versus like what my other peers were telling me with their externships or what I was experiencing in certain placements. I never got those opportunities. So the fact that I was getting these opportunities and just this encouragement for my externship, it stood out to me and made me think like, if this is how it's going to be as an extern, I can only imagine how it's going to be as a nurse, how many learning opportunities I'm going to have as a nurse, and how beneficial that would be towards the learning curves that I would have to endure later on, you know? And then, yeah, it just stood out to me. And the fact that I could have a bond with the nurses beyond nursing also was valuable to me. Like, I could just go to them and talk about my personal life, and even though some of them are a lot older than me, we would still be able to bond and connect. And to me, that really soothed me and made me comfortable. And I don't want to have coworkers that I feel like I can't connect with to some degree, you know. I don't want our dynamic to just be nursing, you know. At the end of the day, we have our own lives. And yeah, I found that very valuable because I was like the youngest on the team there at that time. And the fact that I could connect with my coworkers around me who are older, more experienced, you know, probably didn't have time to interact with me, just stood out to me and told me like, wow, like this is probably the unit that I should be working in. This is really ideal. Like if I can connect with them on a human basis, like imagine how much more comfortable it would make me transitioning as a nurse, as a new nurse, you know? So then, speaking of that, when I ended up deciding that I wanted to be a nurse, the interview process was a lot easier because obviously I knew the manager, I knew who was interviewing me. I got like words of encouragement and tips from other nurses who had gone through the interview process. And then working as a new grad, I entered NGG, which I think is like makes a huge difference in your new grad learning experiences. I already knew the nurses, so I think like a huge, like not curve, but something that kind of is daunting is not knowing who you're going to be working with. But for me, because I already knew the staff, like it already added so much comfort that when you have comfort, like you are not scared to ask questions. You're not scared to go on and do something. You're not like, it's a lot easier for you to not question what you're doing because you have that support, because you've already built that therapeutic relationship with who's teaching you, you know? So I think like my transition was not only seamless, but the learning curve was a lot more seamless, you know, because I had this support with people that I already had these therapeutic, comfortable relationships with. So yeah, as a new grad, like even though like my preceptors were all amazing, I knew that like even to this day, I'm technically, I guess you could still consider myself a new grad, but I'm done orientation. I know that at any time I can just go to a random nurse and I can just be like, hey, I have like a really like simple question. Can you help me? Like, what should I do? They'll just like, no problem. They'll answer the question. They'll even come in the room and assist me with something. So yeah, that's kind of like the gist of like positive working environment and what the work culture looks like in the specific unit that I work in, that really pushed me and was attractive for me.
Now, did you know anything about NGG before getting into it?
I heard about it like kind of like word of mouth, but I didn't really know exactly what that meant. I just assumed it was kind of like just a supportive like nursing new grad orientation. I didn't really know what it entailed, but like girls who were like older than me, or like my peers who were older than me, like I heard they'd be like, oh, I'm getting this new grad position and it's NGG. Do NGG. And I'm like, what the hell is that? And then when I did my interview process, or when I had inquired about working full-time as a nurse there, my manager kind of gave me a little bit of insight of like what the differences would be if I did NGG versus if I didn't do NGG. And NGG was definitely a lot more appealing. And I think everyone should do NGG. I think it's the safest route to go into and transition from a student to a nurse. And yeah, I'm really happy that I did NGG. I think I would be a lot more of a wreck if I didn't.
So what from NGG do you feel made you not feel like a wreck? At those end of those 12 weeks of NGG, what made you feel not like a wreck?
So the amount of time. So for those who don't know, NGG it's called a new graduate guarantee program. And basically it's created to kind of give you more time and more support with transitioning as a new grad nurse. And the difference between that and not having an NGG is you have like less weeks. I believe it's like 6 to 8 weeks or something.
6 weeks.
Which sounds like a lot of time, but it really isn't. Like I didn't even think the 12 weeks was enough. Like I was like even contemplating, should I do an extra week? Because that's how daunting it is to like kind of like get in that mind space of like working completely independently, you know? Also with NGG, like it's a lot more structured, I think. With like a non-NGG, I think also you just don't have that much support. When you're NGG, people know that like your preceptor knows that like they have that obligation to foster that learning environment for you, that positive learning environment for you. Everyone's kind of following along with your progress too. Like you were the NGG educator and you would constantly follow up with us. Should we have any concerns, like we would come to you, or we would go to the manager and let them know. I think it's just like a good program to have to also track your progress. With non-NGG nurses, I find that it's kind of just like as if like a nurse was getting hired onto a new unit that was a nurse in a previous unit at a previous hospital, and there's a lot more like independence. I don't know, I feel like as a NGG nurse, it gave me a lot more support, it gave me a lot more structure, it gave me a lot more growth, or tracking my growth. If I was an NGG, I don't know, I feel like no one would be paying attention to me as much. I feel like I wouldn't have the resources to know where my weaknesses lie and what my strengths are and how I can improve in those areas. And I wouldn't have anyone just kind of like tracking me. Like I have friends who didn't do NGG and their time was so short-lived and they're like, oh my God, like I'm freaking out. How am I going to do this alone? Or they maybe just didn't feel like they had the resources to kind of know more than as much as they could have, you know?
Yeah. Yeah, no, that's how it was. And that's 6
crazy.
weeks.
That's
and
not enough.
No, it's not enough. And so we're so lucky to have that program to foster people. So now when you've got a shift to being independent out of NGG, tell me how you were feeling.
Okay, so I don't know, it's kind of like a roller coaster of emotions, I will say. I remember like the last 2 weeks, my preceptor and I were just getting somewhat heavy assignments, and I was like willing to take on like full loads too, because I really wanted to like push myself to prepare working independently with a full load. And maybe that's kind of my fault. I'm to blame in that sense, because it got a little overwhelming for me. And I remember at that like 2 week, like before I was gonna start, like 2 weeks before, I was like freaking out. I'm like, there is no way I can do this alone. Like, what the hell? Like, you're telling me in 2 weeks I'm gonna be doing all of this independently and I can't handle it like right now? No way. And then I was talking to other coworkers, and they were like, oh my God, like that happened to me too. Like 2 weeks before, I was like, oh my God, this is so overwhelming. My assignments are crazy. But they were like reassuring me in telling me that when you start off, everyone's gonna know, the charge is gonna know that you're a new grad. They're not gonna give you heavy assignments, which also goes back to the huge supporting aspect, right? Like really encouraging me that, and like relating to me that everything's gonna be okay. This is my experience. If you need guidance, like I'm giving you this guidance here. And then a week mark before I was gonna start independently hit, and I was really enjoying it. I'm like, okay, you know what? I think I'm starting to get the hang of things. And then the day before, I was at a friend's birthday, and I'm like, okay, I'm only anxious because I know I'm gonna get home later, and that's gonna give me anxiety because I want to like be well rested before my first shift independently. So I was like kind of going back and forth between, oh my God, like this is so nerve-wracking versus, no, I think I got it. Like I feel more confident, you know? But the reality is like, and everyone will say this, is that you'll never feel ready. You'll never truly feel ready, and you'll never know when you're ready. You'll just kind of learn as you go, and that's kind of how it was with me. And I'm in a position right now where I can say that I really feel comfortable in where I'm at, in my growth, what I'm doing, and the support that I'm getting. And I don't think it was necessary to have taken an extra week in orientation. I think I kind of went into it, and it definitely was a huge learning curve. But I like recently had been like reflecting, and I was like, oh my God, like looking at me like 5 months ago versus now is so crazy. And I always refer to what I always have been thinking about. Like I'll be on shifts and I'll be like, oh my God, Cass told me this. When you were like, actually, Evie, like, because like before I was just finishing orientation, you came to your last meeting with me. And you were asking me how I was doing, and I was like, oh, like, you know, I'm like kind of like indifferent. Like, I don't know if I'm prepared. Like, I feel like I need more time, but also like I think I'm getting more confident. And you were telling me like there's actual statistics that show like the 5-month mark or 6-month mark, students actually start to feel more confident in their skills and like what they're doing. And that's just so true, because I'm like at my 5th or 6th mark, and I'm like, oh my God, like there's certain things that I wouldn't have been able to handle like 5 months ago that I'm like doing well in right now. And I'm like, oh my God, this is literally what Cass is telling me.
Yeah, it's so great when people actually start to think back and look back when I say, okay, when you think about it now, you're at this point, you're like, 12 weeks ago, you never thought you would be ready to be independent. And now 6 months later, you're like, how did I ever think? You're like, I wasn't ever going to be ready, but I just had to cut the apron strings and just jump right in.
Exactly. It's something like you think you're not ready, like you're limiting self-beliefs. Like that's what's limiting you, because you are ready. You just don't realize it. It's something that you just learn as you go. And maybe, like, honestly, I think having that supportive system behind my back really helped in my journey and like my growth. But it's something that you just kind of learn. Like, it's kind of just like second nature. You've been doing it through all of nursing school and then your orientation, and then you think you're not ready for it, but it's just kind of like something you do and you learn as you go. And I don't know, that's like the best way I can describe it, and I think everyone else can probably say the same. It's just something that you learn as you go. You get into there, you're nervous, you're like, oh my God, I don't know what I'm doing, but you actually do know what you're doing. You were going through orientation doing it is just about being confident in yourself, which sounds a little cheesy and like not like really tangible advice, but it's being confident in yourself and knowing that you have the resources to get to this point. You have the support to get to this point and be in that point. I think we get really comfortable as new grads with relying on other people, but the reality is there comes a certain point where you really need to clock in and like use your own judgment and your own critical thinking skills, which is something I've recently come to realize. Like even a simple question like, should I hold this patient's meds? I know deep down that I should hold those meds given the context, but I get so nervous and second guess myself that I'm like, let me just be safe and ask someone else, and they'll give me the same answer that I was deeply thinking, you know? So I think it's kind of like those type of things, like it's your like limiting self-beliefs that kind of make things seem a lot more daunting than they are, but the reality of it all is that you're gonna do fine. You just need to trust yourself, you need to have confidence in yourself, and utilize the resources that you have around you, whether that's an educator, whether that's another newer or more senior nurse, or if it's just anyone around you that you can grab, yeah.
Now, would you say it's a confidence into make your decision? Like, you're developing that critical thinking and that critical analysis. When you mean by developing that confidence, like you've already thought outside the box, you're planning, and it's like you just need that one sort of reassurance that like, yes, my critical thinking and my clinical judgment is right. Like I've made that. Yeah.
Yeah, no, definitely don't go on with like arrogance.
Yeah. No.
That is not safe.
No, it's not.
That's not the advice I am endorsing at all, nor is that what I do myself.
No.
It's just like for example, like I work in CV, right? In CV surgery. So like oftentimes something very commonly that you're gonna have to do is look if you should give beta blockers to a patient, right? But that's obviously based on what their heart rate is, that's based on what their heart rhythm is, that's based on what their blood pressure is, right? Just like it's something that you commonly see on, should I hold this med, or should I message the doctor, or should I ask someone else? Because I've done that so many times, I feel like it's appropriate for me to independently make that judgment myself, rather than thinking, oh no, I'm not sure, let me go ask someone else. Like I want to be able to build on that critical thinking and that judgment, that clinical judgment. So it's kind of like that, what I'm talking about in terms of being confident in your judgment, rather than like constantly having to rely on someone else, because otherwise you're not gonna build on those skills, and it will take a while, obviously, but like things like that, like I think you should be able to kind of discern.
You facilitated your own independence.
Like, yeah, kind of.
Okay, so we have time for one last question. So
Okay.
for the people that are in fourth year right now and they're thinking about where to work or what their next steps is, what's one piece of advice you would give them? What's one thing you wish somebody had told you?
Oh, that's a really good question. There's a lot of pieces of advice that I feel like I didn't know anything about. I would say get your foot in the door ASAP, because there's a lot of competition, especially right now, and it sounds a little stupid, but like if you have more on your resume, like chances are the hiring manager or HR is probably gonna look at that and think that you're more qualified if you do want to especially enter a specialty. So I would say get that experience, get your foot in the door, get an externship, or when you are choosing your consolidation, I would highly, highly recommend doing a year-long consolidation, because most likely those year-long consolidations are going to be in specialties like ICU. CV surgery does a year-long too. So yeah, I would say that, because that experience is really imperative to like knowing like the basics of when you enter as a new nurse. If I wasn't an extern, I wouldn't even know like basic things on like how to even communicate effectively with patients, or like interprofessional communication skills, knowing how to communicate with like PSWs, or knowing how to coordinate if a patient needs to go down to CT or whatever, just like little things too, or like if a patient's on oxygen, can I take them off oxygen if I want to walk them to the bathroom, or should I grab an oxygen tank? Like these little things still help you kind of have the basics of nursing fundamentals. And if I wasn't an extern, or I guess for other people's experience, if I didn't do a year-long consolidation placement, I wouldn't know these things. Like I've noticed that non-extern students aren't as comfortable and as familiar with like how things operate in the bedside, and a lot of like other soft skills as well that are really important to know as a new grad. I would say experience is very, very important.
Okay. Well, thank you. Thank you so much for coming and joining and sharing your experience today.
I feel like I was like going on a bunch of tangents.
No, your tangents were awesome, because it gives people perspective, and you may have answered questions for people that they were thinking about listening to this, and you just kind of answered them without even being asked. Hi everyone, if you liked our video today, please like and subscribe, and don't forget to go to vitalpath.ca and check out our free career kit.